I'm Professor Paul White. I'm a consultant clinical scientist and head of clinical engineering at Adam Brooks Hospital. I'm a visiting professor in clinical engineering at Anglia Ruskin University and an NHS England clinical entrepreneur. Yes, clinical engineering is a wide specialism. There are a number of elements that contribute to that. So clinical engineering is also predominantly equipment management. I provide strategic equipment management to the trust and the sort of replacement strategy to management exec. We also head a team of 54 people that provide equipment management and plan preventive maintenance. We also have an innovation team that take unmet clinical needs and develop novel medtech devices. We also have a consultancy arm for that, working with small and medium enterprise to look at development of medtech devices and solutions. And also head an international research team in cardiothoracic medicine. What got me started in clinical engineering was I was actually swinging around the high bar. I used to do international gymnastics and was very interested in gait analysis. My late father also worked for Tektronix and they developed oscilloscopes and therefore in terms of early monitoring. And I initially started in respiratory physiology but then moved across to bioengineering at the Royal Brompton Hospital and have continued to work in bioengineering ever since. The opportunities are endless. I get as much satisfaction today, 34 years after I started, because you can actually see the benefits to patients directly from the research that we've undertaken. Trying to single out one project is very difficult. I've been involved in many projects over the years. My HNC project, because I came up that route, started looking at different types of nebulizer and laser particle sizing of that to look at distribution of particles in the lungs, through to looking at how changes in physiology. So we identified that in heart failure and early diastole, the heart sucks rather than actually has pressure changes for ventricular filling. We also looked at isovolumic acceleration waves and did a whole load of evaluation of those as a surrogate of systolic contractility, and these are now actually seen in most scanners, ultrasound scanners. I suppose one of the biggest projects I've been involved in the last 8 to 10 years is the deceased circulatory donor transplantation project, where we take deceased circulatory donors and actually use them as a source of transplantation. This work is internationally renowned. Royal Papworth has done more DCD transplants than any other transplant centre in the world, and therefore we're leading on that. I think my biggest challenging barrier is time. So I'm still doing the sort of the clinical engineering aspects, the innovation aspects to look at unmet clinical needs and spinning out some of those where appropriate, and also trying to do the research. So that's one of the biggest challenges. One of the other second biggest challenges is in the DCD program. So this is a world-renowned program. It's given 54 people the chance of life that they would not have previously received. But the program isn't commissioned by NHSBT. It's actually being funded by charity. And an example actually last week is that we were teaching a very large university North American hospital about the work that we've been doing, and the fees that we charge for that we've put into the charitable account to continue to do more research and more clinical activity, because the DCD program has now moved from research into clinical activity. I think the biggest rewarding part is being able to see immediate changes to patients. So the research that we've been doing over the years is being taken up into clinical practice, and it was also being taken up not only in the UK but internationally as well, and that gives it a great buzz and is inspirational, but both for us and also for others from the work that we've been doing. I don't think I've changed much, to be fair, but the advice I would actually give is take every opportunity when it comes, because that is exactly what I've done. I've taken every opportunity, but also take initiative. You also have to make sacrifices. Not everything happens between a 9 to 5 environment, and therefore sacrifice outside that is important. But also having an understanding family also helps. What we've got planned for Healthcare Science Week is a series of interactive presentations and also stands in the foyer to identify to patients how they come in contact with healthcare science during their clinical pathway and during their journey through the hospital, from diagnosis and treatment through to therapeutics.